MDSeminars.com. Today I'm just going to go over what should be a simple hamstring stretch, assisted hamstring stretch, that most people I notice end up doing incorrectly for various anatomical reasons. So one thing that you want to consider when you're doing a hamstring stretch, if I just straighten his legs out here, is that if you have his leg straight like this and you're bringing it up into a stretch position, because of the sacrum's ability to counter-nutate, you can actually get a false reading of hamstring flexibility due to the fact that when you engage the hamstrings full length, the sacrum will simply counter-nutate, your lumbar lordosis will be lost, and that'll increase the amount of flexibility or the amount that you can bring his leg up. So the number one thing to go over is when you're doing an assisted hamstring stretch is to always have the patient tuck their hands underneath the small of their back to maintain an adequate lumbar lordosis. So if I keep his leg straight now and I bring it up, you see how a more true hamstring length is restricted. Now if he takes his hands away from his back, you'll see that his leg is able to go a heck of a lot further. Okay, so if we're just concentrating on hamstring stretching, make sure his arms are underneath the small of his back in order to prevent that sacral counter-nutating. The other thing with stretching the hamstrings is that most people tend to do it, if you can put your arms behind your back again, most people when they're doing an assisted hamstring stretch, they'll do something like this. They'll try to block the person's knee from having any amount of flexion, and then they'll kind of stretch up this way. And when you query the patient as to where they're feeling the stretch, they're always going to tell you they're feeling it in the popliteal fossa. Now, anatomically, you know that in the popliteal fossa, we do have the tendons of the hamstrings, but the bulk of the muscle belly, obviously, is in the mid-thigh region. So technically, if you're stretching in this fashion and you're feeling a pain or a pull in the popliteal fossa, you're technically not stretching the hamstring muscle. Further to this, what a lot of people end up doing is because in this position you're also tensioning out the sciatic nerve, a lot of people are doing a whole lot of sciatic nerve stretching and tugging and very little hamstring stretching and flexibility training. So if you're in this position, if you're very careful with your palpation skills, you'll be able to note that the sciatic nerve will actually tension out in almost 99% of your patients before the hamstring does. And I don't have to go over the reasons why aggressively stretching a nerve would be a bad thing. What I often find is a lot of people that have low back pain with pain going down into the hamstring or chronic hamstring tightness, it actually ends up being sciatic nerve frictional irritation around the hamstring tendon insertion. So by doing a stretch like this where you're engaging the sciatic nerve, chances are you're going to make that pain a lot worse for the patient. So a more effective way to actually get the stretch to occur in the mid-hamstring belly is to go ahead and allow bend in the knee. So block the hip flexion with the opposite knee, like I'm doing in this position here. Allow some bend in the knee, and then put your hands in the popliteal fossa and flex forward. Now when you get to the end point, you can then use a little bit of hamstring or knee extension in order to engage the hamstrings more or less. And the whole time you're doing it, you're asking the patient where he feels the pull. If you're doing a true hamstring stretch, you're going to be feeling the pull in this region down here, not in the popliteal fossa. Okay? So things to remember is number one, always put the arms behind the back to prevent that counter-nutation and cheating. Number two, the thing that you want to block is knee or hip flexion on the other side. Number three, keeping the knee into a extended position is not necessarily the best way to engage the hamstrings. So alternatively, or what you want to do is actually leave a little bit of a bend in the knee, slacken out the hamstring with hip flexion, and then use a little bit of knee extension at the end point in order to engage the hamstrings more effectively. Further to that, if you're giving one of your patients a stretch to do at home, similarly, instead of getting the person to put their leg up on the highest thing that they can possibly find to stretch the hamstrings, what would be more effective to concentrate on the muscle group itself is to get something relatively low like this. What you want to avoid is the same thing. You want to avoid having the knee perfectly straight and having the toe up. What you find a lot with people when you do that is that they complain about a burning pain in the calf. which might actually be due to that sciatic nerve tension that you're causing by doing the stretch. So, more effective way to get that mid belly is to put the foot up on the bench or whatever you're doing it on. Keep a slight bend in the knee, and then the stretch is not going to come from my body coming forward, but rather it's going to come from me lifting the glutes up and backwards. So you're in this position here. What you want to get them to do is increase their lordosis as much as possible and bring their chests upwards. So raise the chest to the sky and glutes up and back as much as possible in this position here. And you should feel the stretch in this region. If you're feeling it again in the popliteal fossa, you might have to adjust your positioning either by bending the knee more or a little bit less in this position here. Okay.